Hi, everyone, and welcome back to Time 100 Talks. I'm Edward FELSENTHAL, Editor-in-Chief and CEO of Time. Thanks for joining us. If you haven't been with us before, Time 100 Talks is our new event series where we bring together amazing leaders from around the world, from across fields, to spotlight solutions and encourage action toward a better world. Today, our topic is leading through crisis. This pandemic has put extraordinary pressures on all of us and presented unprecedented questions to the leaders of the nation and the world. Like, how do you stop the world and how do you restart it? How do we think about both life and livelihood? How do we summon the creativity, courage, and empathy that this moment demands? Today, we have with us three remarkable leaders: Michigan Governor Gretchen Whitmer, one of America's most visible leaders in the fight against COVID-19. She's navigating how to reopen her state. Dr. Raj Panjabi, CEO of the Last Mile Health, an amazing organization that's dedicated to expanding access to healthcare in remote communities where the threat of the virus is growing, even as some restrictions are being lifted. And at a time when there is so much division in the world, there is one thing we can all agree on, and that's Dolly Parton. She is not only a music icon who's paved the way for so many others, she's helping to fund research on a COVID-19 treatment and doing some remarkable things to help kids around the world cope with life at home with their families. I'll be talking with Dolly, and we also have the privilege of sharing the exclusive video premiere for her brand new song, When Life is Good Again. Before we start our conversations, though, I wanted to share with you a video, a conversation that Katie Couric had in our Time Report series with Nicholas Johnson. Nicholas is the first Black valedictorian in Princeton University's history, and he spoke with Katie about the unique moment that those in the class of 2020 face, how kids, teens, and young adults are dealing with this crisis and seeing the world that comes after it. This was the subject of our most recent issue of Time, entitled Generation Pandemic, and Katie delves into it with Nicholas.
My name is Nicholas Johnson, and I'm part of the class of 2020. When I was first notified that I was in fact the first Black valedictorian in the university's history, I felt extremely empowered. The fact that it has taken so long for there to be a Black valedictorian also speaks to how much work still needs to be done. Ideally, we need to strive for a world where this type of achievement is more normalized and doesn't make national news. Particularly given the university's historical ties to slavery, I think being the first Black valedictorian is an extremely significant event. Princeton's first 9 presidents were themselves slave owners, as were several professors during the early years of the school's operations. And coupled with that, slaves have previously been auctioned off on Princeton's campus. That being said, I think the university deserves an incredible amount of credit for work it has done over the past few years when it comes to being very critical about its past role in perpetuating slavery and in making sure that stories that have previously been hidden are in fact very much told to students and to the public more broadly.
What advice would you give all universities to better support their minority students?
I think it's important for minority students to be afforded spaces on campus that are very much committed to their particular identities. At Princeton University, we have a wonderful center called the Carl A. Field Center for Diversity and Inclusion, which in some sense really serves as a hub for a lot of minority student life on campus. So I think that center is an excellent example of what a university can do to really help support minority students. My generation, members of the class of 2020, will come out the other side even more committed, with even more resilience, to work to create world systems that are more robust against challenges similar to COVID-19. The pandemic has certainly revealed limitations in healthcare systems around the world and in global supply chains. And I do think that ultimately we will be able to come out of this on the other side with better systems in place.
What's ahead for you, Nicholas?
I'll be starting PhD studies in the same field, operations research, at MIT in the fall, and I'm really excited to get started.
How proud is your family of you?
My family is incredibly proud. both my immediate family, my parents and my older sister, Anastasia, and also my extended family. I have a lot of family in the Bahamas and in Jamaica.
Nicholas Johnson, valedictorian of Princeton University's class of 2020. We salute you and congratulate you.
Thank you very much. It's my pleasure to be here.
Thank you, Katie, and congratulations to Nicholas on his historic accomplishment. Next up is my colleague Molly Ball, Times national political correspondent. Molly will be having a conversation with Governor Gretchen Whitmer of Michigan about her approach to reopening the state and her thoughts on how we're reopening America. Molly?
Thank you, Edward. I'm Molly Ball, and I'm so pleased to be joined today by Michigan Governor Gretchen Whitmer. Governor Whitmer, thank you so much for joining us today.
Happy to be with you, Molly.
I want to first get your thoughts on something that's happening not in your state, but in Minnesota, the widespread anger over the death of George Floyd at the hands of the police. What do you think of that situation and how it's being handled?
Well, I mean, I think what we know in America is that we have a real issue here. This is a community that is rising up because of the way that George Floyd was treated and killed. In the United States of America, this is a story that has played out many times. Kind of like what we're seeing with COVID-19, there is a real racial disparity in our existence, and this has held up a mirror to us as a country. And so it's, incumbent on every one of us who has a platform to make sure that we use it to ensure that every American is safe and protected under the law. And we have a lot of work to do, as this shows.
What can we do as a nation to end this police violence against African Americans?
I mean, there are a lot of things that we can do. We know that having real representation is important. We know that training is incredibly important. We know that getting justice when people are out of bounds or take action like what we have seen in this most recent disturbing video, but we've seen it many times in this country. I think each of these is an important part of the solution, but it also needs to be determined with people of color at the table, devising what actions need to be taken. I think that we've really missed incredible important moments in this country where we should have been taking these actions, and yet here we are once again. And my heart goes out to the family and friends and loved ones of Mr. Floyd.
And I meant to ask you this at the top, but where are you coming to us from? Are you at home? Are you in your office in the Capitol?
I am at the governor's residence in Lansing, Michigan.
Wonderful. Nice decor, nice bookshelves. I like it.
We try. I know I haven't given this much thought to what these bookshelves look like until I did all of these interviews from home. And so
now everybody's inspecting them. Going back to Michigan, you have started the process of gradual reopening, even as obviously the threat of the virus still looms. It's a difficult calculation to try to balance the threat of illness and the importance of people's economic needs. How are you approaching those decisions? What's driving your approach to this process?
Well, first and foremost, staying tethered to the science and the epidemiology and listening to our great leaders when it comes to public health. I am fortunate that every step of the way, I've got the counsel of the University of Michigan School of Public Health. I've got the counsel of Dr. Janae Khaldun, who is our chief medical executive here in Michigan. I have been able to stay close to my fellow governors across the country and get the benefit of advice from some of the leading epidemiologists nationwide. And that's what's going to continue to drive all the decisions that I've made. I'm working with the business community to make sure that as we re-engage sectors that we have the proper protocols. I know that people in business understand their business a lot better than state government does, but they're also motivated to make sure that when we re-engage, we stay re-engaged. No one wants to have a workplace that employees don't feel safe coming to, or the general public doesn't feel safe patronizing, and that's why we really are trying to make sure that we get this right. And it's been difficult. Michigan's experience with COVID-19 was harsher than a lot of other states. We for many weeks had the third highest number of deaths in our country, even though we're only the 10th largest by population. And so it took very serious steps to make sure that we, flatten the curve, and we have done that. I am concerned that as the weather continues to get nicer in Michigan, and as with the longer this goes, people might think about dropping their guard, and we all want to avoid that second wave. That's one thing I think we're unanimous in.
Yeah, I mean, given that some people seem to already be flaunting the guidelines, how can you make sure that people actually do what they're supposed to do while this reopening is underway?
I think it's the challenge, right? We are relying on human beings who are imperfect and are independent and are, have to make their own decisions. And that's precisely why I think it's so critical that everyone with a platform, whether it's at the federal level or the state level, is talking about what the science in it is and is promoting best practices, not mocking mask wearing when we know that wearing masks is what we all need to be doing until we have a vaccine or a cure. And that's months, if not longer, off. And that's part of our challenge here, is to make sure that we stay tethered to the science and that we continue to prevail on people to keep their guard up and to keep practicing these steps that we know will protect us and our families.
And you alluded to some of the inconsistent messaging from the federal level on this. Are you concerned that we're heading toward a polarized situation where Democrats won't leave their homes, Republicans won't wear masks, and the whole thing becomes politicized? Is that where we're heading?
Well, I think unfortunately it has become politicized. And what I am hopeful that we can do is to have people on both sides of the aisle use these platforms to educate the public and to make sure that we keep public health out of partisan conversations. This is about all of our health. This is about our economic health as well. One of the people with whom I've conferred relatively regularly is Governor Mike DeWine. Now, Governor DeWine and I are neighbors. He's from Ohio, I'm from Michigan. We're very different, though. He's a Republican, I'm a Democrat. We have very different ideas about policy and about what the world, issues that we want to tackle. And yet, he's someone that I've talked to relatively regularly because they're watching the science as closely as we are in Michigan. And the more we can, share information, he gets the benefit of the U of M and I get the benefit of the Cleveland Clinic. We are thinking about things in similar ways, even though we might be tackling them at different cadences. And I think it's important that people see their leaders on both sides of the aisle take this seriously and take actions that we know will protect life.
Over the weekend, your husband was accused of abusing his position as first gentleman to cut the line and get his boat in the water at your vacation home. Do leaders and their families have a responsibility to set a good example in this regard?
Absolutely. And my husband made an unfortunate and not funny joke suggesting that, would I move up the queue if you knew my wife was the governor? He thought it was funny because at one point I had precluded people from using motorized boating. He thought they would find it funny too. They didn't. I don't find it funny either, and he regrets it a great deal. It wasn't meant as anything other than to find a little humor in this tough situation, and it very clearly fell flat, and I think a good lesson was learned.
Are you surprised that the dock owner, the small business involved, chose to turn this into a public controversy?
It was interesting. They posted something, but they also said he wasn't, he didn't press the issue. It dropped immediately, that he, conducted himself like a good person would. And so I appreciate that. I think right now in this hyper-polarized moment, everyone is looking for fault in one another. And it's unfortunate. I'm hoping that as time goes by, we can get back to a place where we give each other the benefit of the doubt, where we don't seek to find fault with one another immediately, where we try to all rise to the occasion. And that's precisely what I've been trying to implore people of our state to do, and certainly something that is incumbent on all of us.
Your state has been the focus of some of the largest and most intense anti-lockdown protests after your initial emergency order. What was your reaction to those protesters, some of them heavily armed, who came into the legislative chamber?
Well, I think it's unfortunate. It really is a small group of politically motivated individuals. I know that my stay-home order is not universally embraced. I get that. But I also know that when you see this group show up at the Capitol with their Trump float, their Confederate flags, their likenesses of me in a noose, this is a political statement, and it is a political rally, and it is a small group of people. This is a state of almost 10 million people. 1,000 or 2,000 people at the Capitol looks like an immense number on television, and yet the vast majority of people in the state are taking this very seriously. They support the work that we have done here, and they recognize that we have saved lives because of it. And so I am, focused on the fact that our numbers have come down precisely because of the work that we've done. And I'm not going to be bullied into making decisions based on politics when I know public health is at stake and we're talking about people's lives.
Why do you think you've been singled out in this way when so many other governors have taken a similar approach? Do you think that the president has played a role in inciting these protests?
Well, there's no question that the tenor of political discourse in Michigan changed when the president started tweeting about me. It really did. The legislature with whom I'd been working very well, that's Republican controlled, would not extend my stay-home order after that point in time. In fact, they went to court to try to sue me and challenge my executive authority. I won that challenge at the trial court. Of course, they're going to appeal. But I think that the whole tenor changed when the president made it political. And I think that that's an unfortunate thing as you analyze what we have accomplished in terms of the stay-home order and the flattening of the curve and the undeniability that we've saved thousands of lives in this process, and we're now starting to re-engage our economy in a way that is really smart.
You traveled today to the Midland area, the site of the massive flooding in your state, and directed the State Department of Environment to conduct an investigation. Some have alleged that the same Department of Environment contributed to the disaster. Will the investigation be able to look at the state's potential role in what happened? Should there be an independent investigation?
Well, I think first and foremost, we have to have the people who understand the issue be the ones that investigate it. This is, we had a failure of one of our energy companies last winter, and it was the Michigan Public Service Commission that needed to investigate it. That's how these things are done and done well. If it appears that we would need to have additional, eyes look at it, that's certainly something that I am open to. But it is the regulation of dams happens in that department, and to ask another to do it that doesn't have that expertise, I think would be not a fruitful endeavor.
Dealing with a natural or quasi-natural disaster on top of a pandemic's obviously a nightmare situation, and one that a lot of other leaders might find themselves in, especially with hurricane season coming up. Do you have any advice for them from your experience with the floods?
I think that with this experience with this flood it was a surreal moment where I was at the State Emergency Operations Center announcing that we were evacuating 10,000 people in the midst of a global pandemic where we're trying to, observe social distancing and face mask wearing and proper hygiene. It is a circumstance I could never have imagined. And I found myself saying that night at the State Emergency Operations Center when I was declaring the emergency, this is unlike anything we've ever seen before, which is the same phrase that I've used many times over the course of the last 10 weeks. It's surreal. And yet we have to continue to do the next right thing. We have to stay focused on the fact that these are people's lives at stake. We've evacuated 10,000 people overnight in the midst of this global pandemic and floodwaters rising, and no one died. It was an incredible feat. And I think that certainly there will be moments where we will need to assess every step along the way. But when you look at it from that perspective, it really is an operation that worked well. We still have a lot of work ahead of us, to be sure. But I think as long as we stay focused on doing the next right thing, we're going to get through this.
I've been thinking a lot about this as we watch, different leaders navigate this differently. What do you feel like people are looking for from their elected leaders? What do you feel like your constituents need from you in this moment?
Well, I do believe that people need calm. They need to know that there is competence, and they need to know that there is hope. These are fundamentals that in a time of crisis are absolutely essential. The consistency of a message that is informed by the best science. We know that we're learning so much about this virus. It is a novel virus. That's the nature of it. There are things we don't know because we've never seen anything like this before. And yet we have to continue to keep the public informed. And that's what I think people are craving in this time where there's so much anxiety of the unknown. People are craving some consistency and calm and competence and hope.
Going back to the president for just a moment, has there been any follow-up from Washington on his recent threat to hold up funding to Michigan over absentee ballots?
So that tweet was fired off about a week ago, and it was unfortunately the same morning that I was flying to Midland, that the first time when I did the aerial assessment of the damage. I spoke with the president that day, later that same day, and he didn't mention anything of that. And so it is my hope that perhaps that was a focus of the moment and not a long-term plan. I also have the fortune of having a great congressional delegation, bipartisan delegation that we've been working closely with, because we need to make sure that we can't let any politics get in the way of our ability to get the resources we need to help people in this time.
You also said last week that you recently had a conversation with Joe Biden's campaign about the possibility of joining the ticket. Has there been any further conversation there? What was that conversation like?
I made one offhand comment and everyone's read a lot into it. And I certainly wish I would have bitten my tongue, but I haven't had regular conversations with the campaign throughout. I endorsed Joe Biden before the Michigan primary, which was on March 10th. We have been, close since he came out, and we got to know each other when he helped me get elected back in 2018. And so there are a lot of people working with the campaign that we speak to regularly. With regard to, the potential of a vetting, an initial casual conversation was had, and there's not been anything since.
If you were Joe Biden, would you pick you for the ticket?
You know what? Joe Biden has a phenomenal group of people that could be excellent running mates. And no matter who is on that ticket, I am going to be an enthusiastic supporter here in Michigan. And I am confident he'll be a fantastic president.
Do you support his pledge to put a woman on the ticket?
I think that, that was his pledge, and I think that for a lot of reasons, it's the right thing to do.
Are you willing to predict that Joe Biden will win Michigan in November?
I'm going to work like heck to make sure of it.
Thank you so much, Governor Whitmer, for your time and your insights. I'd now like to introduce my colleague, Alice Park, Time's senior health correspondent. She will be speaking with Dr. Raj Panjabi about increasing access to care in the midst of the coronavirus.
Thanks, Molly. I'm Alice Park, and it's my pleasure to welcome Dr. Raj Panjabi, co-founder and CEO of Last Mile Health. Raj, thank you for joining us for this Time 100 Talks.
It's great to be on, Alice. Thank you.
I wanted to start by asking, how are some of the communities that you work with doing? You created Last Mile Health to focus on bringing healthcare to populations that are just out of reach of traditional health systems. How has COVID-19 impacted them?
Well, a lot of that work is happening in Africa at the moment. We're working with several countries, Liberia, Uganda, Malawi, and Ethiopia in particular. And you're also seeing these countries try to deal with two challenges. One is, how do we achieve rapid and sustained viral suppression by doing the testing, the contact tracing, and making sure treatment and isolation happens for those who are infected, but also dealing with an epidemic that I think is less reported on, which is this collapse of the health system and the fact that people are also at risk of dying from conditions that they've lacked access to healthcare for. For instance, 80 million children, babies around the world, reported last week by Gavi, may not get any vaccines at all for measles, for polio, and those can lead to excess deaths. So these countries are trying to deal with those issues, and we're seeing that in many low and middle income countries, that there's a dual threat, the virus itself, but there's a threat from the fact that people will die from other epidemics because the virus is disrupting the healthcare systems.
And you created Last Mile to really address that gap, right? And as you said, the collapsing healthcare systems by really relying heavily on community-based efforts and training leaders in the community to address many of these health issues. It seems that in a situation like COVID-19, where there's no drug yet, there's no vaccine yet, and we're really dependent on behavioral approaches like social distancing and sheltering in place, that these are kind of strategies that community-based workers are sort of ideally trained to implement. Can you talk a little bit about how some of these programs have been brought to those areas where the health systems are compromised, and what lessons, we might learn for the rest of the world?
The science here is pretty clear, right? The virus has many of us on lockdown at the moment. If we want to put the virus on lockdown, we've got to do really 4 key things. We've got to test. We have to isolate or treat those, at least get them into supportive care, those who test positive. We've got to find or trace other patients people who've been exposed to those confirmed patients. And then we've got to quarantine those who are exposed and make sure they get the right social support if they're quarantined at home, or get the right treatment if they're at the hospital. So think about those as 4 sides of a box. If we want to box in the virus and put it on lockdown, we can really rely on community-based health workers, right, to do this. We've got to shift our thinking. I was just in a clinic at Mass General Hospital last weekend volunteering in a COVID testing clinic. We saw 67 patients, and every one of those patients had to pick up a phone and call their primary care doctor to get screened and then come in to the clinic. And 67 patients is an important number. It's a number of patients that were tested there, that got care there. But that's probably the tip of the iceberg of the epidemic, right? Outbreaks start and stop in the community. So unless we are being proactive in finding patients who may be symptomatic, isolating them instead of waiting for them to pick up the phone and come to the clinic, we're not going to get ahead of this epidemic. So you're seeing countries like South Africa train 28,000 community health workers. You're seeing the same thing done in Ethiopia, where they're training health extension or community health workers there. The Liberian government, which had a tremendous amount of experience with community-based health workers during the Ebola epidemic several years ago, train and retrain those community health workers that have been dealing with malaria treatment in the community or delivering vaccinations, training them to screen for COVID. And you're seeing a very different set of results in those countries. South Africa trained these 28,000 community health workers to screen for COVID. They were able in the first month to screen 7 million people. That's 1 out of 10 South Africans. So imagine if Boston screened 1 out of 10 Bostonians, how many more patients we would have been able to find in that clinic. We simply can't do this without a community-based approach, in my opinion.
And contact tracing, what you mentioned right there, is a little bit of a complex issue because it involves what some people feel is an invasion of their privacy. If we're trying to find people who, those who test positive have been in contact with, what are some of the lessons that you could impart to us about those trained workers there and how they do it in South Africa, for example, that might help us to smooth over that transition here and around the world as contact tracing becomes more and more of a critical issue in coming months?
What is contact tracing, right? It's this basic method in public health that we've used to address other outbreaks, like the Ebola epidemic in West Africa and Liberia several years ago, which my team at Last Mile Health and the government of Liberia worked on. You've got to find someone who is sick and ensure that all the people that may have been exposed to that person are identified, that they're listed, and that they're monitored over the incubation period of the virus. That's the work that has to be done to break the chain of transmission. And while it's not a perfect method, we've seen that it's absolutely vital in other outbreaks. I'll give you an example with Ebola. During the Ebola epidemic in West Africa, Liberia trained some 10,000 community members to team up with nurses and doctors to go door to door to find the sick, to isolate those who've been exposed, to follow them, to get those who fall sick into care. And in doing that, one outbreak chain after another, you can start to extinguish the transmission chains. Now, we have a respiratory pathogen. Ebola spread person to person through contact with bodily fluids. A respiratory pathogen is more challenging because the transmission happens through respiratory droplets. So in addition to the preventive measures like putting masks on and practicing social distancing, it's important for us to implement contact tracing because we know that even at the peak of an epidemic, while it may not be perfect, there's good data to support that even if we did contact tracing for 50 to 60% of the confirmed cases, we could see a dramatic drop in the number of outbreaks that happen for COVID-19. You know, one of the opportunities I think the United States has, as well as other countries, is to really break this false narrative that's been created that we need to save lives or save jobs, that we know that we can actually create jobs and save lives in this case if we hire the unemployed to be contact tracers, ideally from the very neighborhoods or villages that have been most affected and at risk for COVID-19 transmission.
Yeah, that's an important message to remember, I think. And with that in mind, if and when a vaccine and or drug treatments become available for COVID-19, have you thought about the best ways to acquire and distribute them to people who need them the most? Are there any programs or proposals that you've seen that make you optimistic that sort of equitable distribution of vaccines and drug treatments is going to happen?
I do feel hopeful about it. So when we introduce a COVID vaccine, and I am encouraged by the $8 billion that was pledged by the governments who met a few weeks ago, I think many of them at the European Union, to support the research and development and the advanced purchasing that will need to happen. I know my friend Ngozi Iweala, the board chair of Gavi, was on with you a couple of weeks ago speaking about advanced market commitments, the idea of ensuring that low and middle income countries come together to pool their purchasing so that the vaccine manufacturers are able to develop sufficient numbers of the vaccine. You're also seeing efforts like the Gates Foundation and others to build the manufacturing plant capacity. Pharma and the private sector are also trying to build the manufacturing capacity now so that when the vaccine candidates are successful, we're able to mass produce that. But the last mile here, this distribution, is going to be challenging. Now we can solve that starting today if we take the opportunity to build the workforce, the army of community health workers and frontline nurses that are going to be needed to close the gap. So those workers may be the ones that are doing contact tracing today, who tomorrow can add to their scope of service vaccination. If we can hire the people from the communities most affected to be part of the medical team, I think we have a better chance at closing the equity gap. If we don't do that, Alice, I'm afraid then this looks like viral apartheid. You know, I don't use that term lightly, but the idea that a group of people, whether it's the vaccines, the tests, or treatments, will get access to those vital life-saving tools, and that those will likely be the rich nations and the powerful within those nations, and the poor within those nations, and the poorer nations in the world will get excluded from that, is in fact the story of every pandemic that has happened in humanity.
And with respect to that, public health experts say that we should expect possibly another wave of COVID-19 potentially in the fall, not to mention other new infectious diseases that could strike us periodically. When you look at the challenges that many around the world already face to get basic health care, what makes you optimistic that those populations and those communities can be better prepared and be protected from these novel diseases?
Amidst the hotspots of COVID, there are blind spots of other that we are not seeing. in that there are other healthcare epidemics happening. So just a couple of, and protecting health workers is critical to stopping those epidemics. So let me give you a couple of examples. So in the United States, we're seeing, even in the hospital systems I'm a part of here, that we're seeing half the number of outpatient visits compared to a year ago this time. We've seen a plummeting in ER visits for conditions like heart attacks. That doesn't mean that people are not having heart disease anymore. It probably means that people are afraid to come to the emergency room because they're afraid they'll get infected by health workers who may be. They may be that health workers are being redeployed for other services, or that infection control is in fact poor enough that the health system leaders don't have confidence in keeping routine health services going. That's the same dynamic happening in low and middle income countries, and the outcome of that could be devastating. But Alice, I'm afraid to say that in many low resource settings, Liberia, for instance, where, as you know, I grew up and have had a chance to live and work in for many, many years, I know that my fellow community health workers still don't have sufficient protection. And in fact, many of the countries that have gone out to seek PPE, the protective equipment, are being priced out of the market. North America and Europe have such high volume of need and are able to bring the purchasing power to China and other places to purchase this equipment. The African governments were being priced out altogether. So as reported recently, they had to have had to set up their own supply chain platform, pool their money in a common bank account so they can increase their purchasing power and negotiate sufficient testing as well as this protective equipment for their workers. That has to be corrected, Alice, if we're going to have any chance at staying resilient throughout the ups and downs of this epidemic. I would say even when a vaccine is available, because that won't reach everybody immediately.
Raj, I think that's a great note to end on, a reminder that we need to keep all health workers around the world in mind. Thank you so much for your time and for your continued work to ensure that everyone around the world has access to quality health care when they need it and where they need it.
Thank you, Alice.
In just a moment, we'll return to Time Editor-in-Chief and CEO Edward Felsenthal, who will be speaking with Dolly Parton about her recent donation to fund COVID-19 research and how she finds strength in her creative endeavors.
Welcome back, everyone. I'm excited to be here with Dolly Parton, music icon, cultural icon, 10-time Grammy Award winner, philanthropist, founder of the Imagination Library, which has donated nearly 140 million books to kids. Dolly also recently gave $1 million to Vanderbilt University Medical Center to help in the search for a treatment to COVID-19. Dolly, thanks for being with us.
Well, I'm happy to be with you. Now, I'm out on my patio, so if you hear birds and cars driving by, just let it pass and it won't interfere, but I'm happy to be with you today.
You know, we've been writing about you, Dolly, for decades, and I went through some of our past coverage, and I was drawn to a line you gave to a Time correspondent who went on tour with you in 1977. You said, "When I'm on my rocker, I want to have tried everything." Well, you're a long way from the rocker, but I am told this is your first Zoom call. Is that true?
Well, yeah, this is kind of new to me, all this social media and all that. I'm still an old timer. I always make jokes that I've still got my carrier pigeons, around. But actually, I always used to say I'd rather sit in my rocking chair regretting a few things that I had done rather than sit in my rocking chair regretting that I didn't do all the things I wanted to try. So now here I am at this age, and I've got a rocking chair, but I usually just sit by the fire and write songs and get up and get in my wheelchair and go do something about it. Actually, I've been blessed, and I just love still working, and I love what I do.
Well, you're certainly not an old timer. You've done the Dolly Parton Challenge this year, the Netflix series, the podcast. you're really having a cultural moment. To start, why don't you tell us about the Dolly Parton Challenge and how that came about?
Well, actually, we try to always come up with something, for the times and to try to encourage people and, with whatever we're doing. And it's true that I'm an old timer, but I always say that I'm as old as yesterday, but I'm as new as tomorrow. So I try to stay up with the times. And then when we get a chance to do things like the challenge, it kind of involve everybody because I want to always stay important. I always want to be active. And I feel like I've got a lot to give, even though I've spent my whole life in this business. I really feel like I'm just starting my career every day because I wake up with new dreams every day. So we just try to do all we can to get everybody excited also and to contribute to whatever they can to make life a little better for everybody.
I want to talk about this crisis we're all living through. You grew up poor, one of 12 kids in East Tennessee. Part of what's so devastating about this crisis is how hard it's hitting families that were already at or below the poverty line. Our home state of Tennessee, we share it, has been hit particularly hard. How are you thinking about what we can all do to help families and communities get through this?
Well, I just think that everybody should search their own hearts, search around and look around what's going on in your neighborhood with the families. And I think we should all just do everything that we can to help. And I really admire and appreciate all the wonderful things that I watch on the news every day of what all the, the good things that people are doing just to help. And just the fact that I think this whole thing, as awful as it is, has really brought people together. I know that I'm in a position to help, and that's why I try to do it in every way that I can.
I wanted to ask you about the donation you made to Vanderbilt Medical Center. You've got a long relationship there.
Well, I do have a lot of friends there, and I've made donations before in different departments. My little niece, Hannah Dennison, many years ago had leukemia, and she survived it because of the great care that they gave her. And so I had actually donated some money to the cancer center and at different times. And so I just thought when this came up, I just thought that it was the thing to do. I always just follow my heart. I just always have a little voice in my ear that says, do this, do that, and when. So when this all came about, I thought that would be a wonderful thing. I know they have a lot of great scientists there. And my friend, Dr. Najia Boomrod, has been my friend for years, and he had told me, he's in research there. He used to be years ago, really heavy duty into that, and was the head of a department there. And so he told me that they were doing some great strides and coming up with something. And I just felt led to just make a donation to try to further that along. And I think they are making a lot of advanced, thing in a cure for it, or at least to bridge the gap there until they do find a vaccination and a cure.
It's an extraordinary global effort, the search for vaccine, the search for treatments, unprecedented. You also recently started a YouTube series, Good Night with Dolly, reading bedtime stories to kids. I noted that the first was Little Engine That Could, and that your YouTube reading of it had more than 700,000 streams. I think I've read that book to my kids more than 700,000 times. Wonderful. How did that come about, and how's that going? How are you choosing the books? What's that experience been for you, and what are you hearing back about it?
Well, everybody's really enjoying that. For those that are watching that don't know, my Imagination Library is where we give books to children from the time they're born, once a month until they start school. And so the Imagination Library, I'm very proud of, and we've given, as you mentioned, I think earlier, that we've given away 140 million books or so, somewhere in that area. But then when all this stuff started and everybody started having to be confined in their homes, kids couldn't go to school, and parents were kind of having to babysit and be teachers and do everything. We came up with the idea, David Dodson, who is the head of our, kind of runs the foundation. He doesn't kind of, he does. Anyway, we came up with the idea that I should read to the children. And that's just was something else I wanted to do to try to help lift people up and throw a little fun in there and just something for the kids at night. And maybe the parents could enjoy it too. And I've had a lot of comments on the fact that the parents enjoy it about as much as the kids do when they're trying to get the kids down.
Well, we can all use a little, as parents, a little extra help. And I was interested even in how you're choosing the stories. Are there lessons in the stories?
Well, actually, through our imagination library, there's a whole group of people that really decide on what's, age appropriate and the stories. But The Little Engine That Could, of course, is the first book that's in the imagination library. And I loved that book when I was a kid. I think that really kind of helped me in my own life to say, I thought I could, I think I can, and I'm a little engine that did, as I mentioned when I was doing the reading. But we choose the books based on the stories, whether it's about bullying or whether it's about fear, and whether it's about just sharing and caring. And so we really try to pick subjects, and certainly in this series that we did here, to where it would really speak to children about all the things that they need to learn and need to know in a fun way.
Yeah, explaining what's happening right now to particularly young kids is incredibly challenging.
I don't have children of my own, but I grew up, as you mentioned, in a large family, and I kind of practically raised, several of my own brothers and sisters, and now they have children. They're like my grandchildren. So I'm always like reading to them and all, but I really see how this has affected them. And it's really tricky trying to explain to them when we don't even understand it ourselves. We've learned a lot about ourselves and about other people and how they're dealing with this. And hopefully we're going to be better people, when we get through all this.
Is there a song or an album that you turn to in difficult times? What have you been listening to lately?
Well, I usually don't listen to music as much as I try to write some. I try to create things that I think people would like to be able to express, because I've always been grateful that I'm a writer. And so I not only, it's my therapy to be able to write songs, but I see and hear what other people are going through and what they feel. So I really try to write what I think everybody is going through right now. And I'm a very spiritual person, so I pray every day that God will lead me into what to say and what to do. And I've really come up with some wonderful things lately that I really feel like that people will need to hear.
Well, we're going to hear one of those shortly on Time 100 Talks. You've composed more than, I think, 3,000 songs, which not everybody realizes about you. An incredible number of songs. And I recently learned that you wrote "I Will Always Love You" and "Jolene" in one 24-hour period. Is that?
It must have been, yeah, because we found a tape. I didn't realize that either, because but they both came out like within a couple of years. But we were going through my vaults and through my old boxes and of tapes, and we found a cassette that both those songs were back to back on the cassette. And so evidently, I don't remember, because at the time you write, you don't know what's going to be a hit and what's not going to be a hit. But we were just shocked, that both those songs were written whether it could have been a day after, whatever, or it could have been the same night, but they were back to back on the tape. So whenever I had been writing, I wrote them in that same period of time. And I myself was really surprised, although I know they both came out in the early 70s. So stands to reason that.
Pretty creative 24 hours.
I know, that was a really good night. I had this little house where I lived, and I remember writing both songs, but I don't remember. I remember sitting by the fireplace, but I did not realize till then. And we all went, "Wow, those both at the same time." I thought, well, thank you, Lord. That was a good night for me.
It was a good night.
Yeah.
You've become an icon for so many women and girls, particularly all over the world. And yet you don't think of yourself as a feminist.
Well, that's really kind of a tricky question. I suppose I am a feminist if I believe that, women should be able to do anything they want to. And when I say a feminist, I just mean I don't have to, for myself, get out and carry signs or I just really feel like I can live, my femininity and actually show that you can be a woman and you can still do whatever you want to do. But I'm not ashamed of that title. It's just that there's a group of people that kind of fit into that category more than me. I just always say, I don't really go for titles or this or that. I just live my life and hope I'm a good example, and I try to live it and write it and sing it and do all that. But I'm all for all our gals. I think everybody has a right to be who they are. I don't care if it's men, women, girls, boys, gays, straights, black, blue, alien, gray. I think everybody has a right to live, be productive, and be who they are.
Well, you know, it is amazing. The New York Times last year in a story about you said that you're the one thing everybody in America can agree on. The one thing everybody can agree on is Dolly Parton. You do have a remarkably diverse fan base. It's rural and urban, it's young, it's old, it's religious, it's non-religious. When you look around and you see how divided our politics are and so much of our society is, and even the divisions, the inequities of the way this crisis is affecting different groups, are there lessons in your story and the way you've conducted yourself we can take from that and bringing people together?
Well, for myself, I grew up in a very big family, so I know every type of personality. I also grew up in a religious family. My grandpa was a preacher, so we tried to learn to be caring and let God be the judge. We're not the judge. And I just happen to love people. I have a very open heart. And when I write, just like the song we're going to play today, it's like it has that very line in the chorus where it says, "And when life is good again, I'll open up my heart and let the whole world in." And hopefully that's how other people feel. And you know, it's like, and just to let everybody love, let live, let love, whatever. So I just really have never been judgmental, and people kind of grew up with me. They know I come from a Cinderella story. And so I think people just know that my heart is good. I like to think it is, even if other things ain't, you know, something you care about. But I know that I really care about people, and I want people to be happy.
Well, the message of that song, which we're going to hear soon, is that there will be life on the other side of this. We're going to get through this. And I wondered, just closing question, what are you looking forward to? I know you're at home like so many of us. What are you looking forward to on the other side of this?
Well, the song is going to sum it all up. That's exactly how I feel. And I want to get out with my friends. I want to go eat. I want to go down to the seashore. I want to be able to, you know, just have fun and just get out and be free again, touch people, be with them, and, you know, just say hello and just kind of let life be better now, but to get back to kind of, you know, where we're living people. And we will get through it. We will. I mean, everything has to pass. You know, there may be some harder days still, and it might not. You never know. I'm sure we'll probably have to go through some more things, but I try to just keep the faith. I try to let go and let God, as I say in my own heart, is to just kind of be aware, be smart, be safe, and just kind of hope for the best, pray for the best, and live your life the best way you can. And when life is good again, it's going to be better than it ever was. I know I'll be a better person. I can see a lot of things that I can do better than I did before. And I hope that everybody during this time, if God had no other reason for this to happen but to just make us sit down and analyze ourselves and what's going on in the world and how selfish we've been and how blind we've been to so many things that really matter if we're to survive as, you know, as humanity, really, and just in our families. And I really, you know, there's a scripture that says a house divided cannot stand. That means a world divided also, whether it's your own household or just the whole world. I think we have to pull together a little better. It can't, and I just think we're just getting so scattered and so selfish with some things, and we're just letting too many good things go by. I know that I'm going to, like I say, I'm going to be better. I'm going to do better. And I try to do good as it is, but I'm going to do better and more good stuff. And I hope you like the song.
Well, we're excited to share it, and I know we'll like it. Dolly, thank you for your thoughts and your time today. And now it's our pleasure, time to introduce the music video for Dolly Parton's newest song, When Life is Good Again.
When life is good again, I'll be a better friend, a bigger person when life life is good again. More thoughtful than I've been. I'll be so different then. More in the moment when life is good again. I'll open up my heart and let the whole world in. I'll try to make amends when life is good again. We've been brought to our knees. We've been so ill at ease. There are no guarantees, but you know life goes on. This too shall pass away. Bring new and different days. We need to change our ways and right our wrongs. Let's open up our hearts and let the whole world in. Let's try to make amends when life is good again. I'll open up my doors again and hear the message in the wind. Repent of all my sins. When life is good again, I'll try to be someone on which you can depend, a helping hand to lend. Let's open up our eyes and see what's going on. If we're to move along from where we've been, let's open up our hearts and let the love shine in. We've all got knees to bend, and we'll just pray till then. Ask God's forgiveness when life is good again. And it's gonna be good again. It's gonna be good again. It'll be alright. There's a reason for all things. You want rainbows, you get rain. We'll all be forever changed. I'll sail my boat and fly my kite, walk in the park, go out at night, and hold my loved ones extra tight. When everything is on the mend, I'll eat and drink with my old friends, sing and play my mandolin. We'll make it through this long dark night. Darkness fades when faced with light. Everything's gonna be alright when life is good again.
Wow, that was a powerful and beautiful message from Dolly Parton. Wear your mask and lead with love. We can all look forward to when life is good again. Dolly, thank you for your inspiring work and for being with us today. Also, our thanks to Governor Gretchen Whitmer and Dr. Raj Panjabi for joining us today. We'll be back next week for Time 100 Talks. You can get more information about what's coming and watch past episodes at time.com/time100talks. Thanks for being with us and see you next time.